Janelle, I think you're going to be guiding us through, or would it be Tiffany?
That'll be me, Dr. Jameson.
Okie dokie. Good morning, everybody, or good afternoon. And it is gorgeous here in Las Vegas. And I think we are got our quorum, looks like, correct?
That is correct, Madam Chair.
So why don't we go ahead and Tiffany, if you would do the roll call.
I'd be happy to. Dr. Florence Jameson.
Present, thank you.
Ms. Valerie Clark.
Present.
Ms. Lavon Lewis. I see her. Ms. Lavon Lewis.
Present, sorry.
Thank you so much. Dr. Sarah Friedman.
Present.
Mr. Jonathan Johnson.
Here.
Mr. Jose Melendres.
Present.
Quincy Branch, he did let me know that he was going to be out of town on business unless he was able to join us. So I'll mark him as absent. Suzanne Bierman. Not hearing from her. Commissioner Richardson. She on? Okay. And Kelly Anderson. I do see Kelly, but she might not be around, so I'll mark her as present. And Madam Chair, we do have a quorum.
Thank you so much, Tiffany. This is Florence Jameson, and I do see one familiar name of actually multiple, but one that is usually there for our public comment. So let's start with public comment. Tiffany, will you prefer to start with in-person comment and then go to anything that was sent in?
Yes, that would be a nice start, Madam Chair. And for the record, for those who would like to make public comment, just a reminder, if there's any attendees who would like to provide public comment, please raise your hand with your raise hand feature on Zoom, and Katie can unmute your mic, and we'll go from there. And then also we do have our public comment possibly in our Carson City conference room as well.
We have a hand up from Barry.
Thank you. Thank you for the opportunity. For the record, my name is Barry Gold. I'm the Director of Government Relations for AARP Nevada. Unfortunately for me, but maybe fortunately for you, I can't stay for the whole meeting, so I will not be doing another public comment at the end of the meeting. I will limit myself to just this one. I want to reiterate something that I mentioned at the last meeting. I see that you're looking at interviewing and hiring for the executive director. And again, AARP strongly urges that you select a candidate who is first and foremost a consumer advocate. That is so important, that people, that they understand who the market is, who the people are that want to buy this insurance, and that will really help moving forward. Second thing I want to mention is I would like to thank the board. I'd like to thank the marketing agency. When I looked at both the presentation and the marketing report, I saw a couple of different places where it talked about the 50 plus. So I don't have to urge you to include them. I can thank you for including them. And I think that's a great idea, because we all know they have a strong need for insurance. And if you reach out to them the right way, they certainly will purchase insurance. So thank you for that. Thank you for including the 50 plus in the marketing and the outreach. And again, please consider that consumer advocate for the executive director position. And that's pretty much my public comment on behalf of, yes, the 345,000 AARP members across the state. So thank you for the opportunity to give public comment.
Thank you, Barry Gold. And any other verbal present, anyone present who would like to now speak public comment?
We do have, Madam Chair, Tiffany Davis for the record. We have Caitlin in our conference room in Carson City. Caitlin, is there anyone for public comment?
No, Tiffany, there's no one here.
Thank you, Caitlin, for confirming that. With that, Madam Chair, would you like me to go ahead and read the public comment that was emailed to us this week?
Yes, thank you.
Okay, this public comment was received on February 22nd of 2022. It reads, My name is Mindy Pretner, and I have been a broker with Nevada HealthLink and previously healthcare.gov since market inception. My agency, Affordable Health Insurance LV, currently has the purpose of this letter is to provide unwavering support for Mr. Ryan Hyde to become the executive director of the Nevada HealthLink. When Nevada HealthLink first came to be, the website was good, but there were issues that required rectifying from the broker standpoint. A post-enrollment survey was sent to brokers, but the questions were more for data collection than where real concerns could be addressed. In turn, I wrote a 6-page single-spaced letter with suggestions for improvement. I was very happy when Ryan reached out upon receiving the letter, as well as following up multiple times during the year to check on and give me updates on some of the concerns. He did not make excuses or simply listen. He devised strategic plans to fix the issues. As a direct result of Mr. Hyde's leadership, the enrollment process was considerably more efficient and effective for this enrollment season. I reached out to thank him and let him know I would have a similar but less expensive request list for this year. Once again, Mr. Hyde was welcoming to the input, and I have already seen follow through on this year's request, just 1 month out of open enrollment. My agency has close to 1,500 clients. As a broker, when I have an issue, I need to feel supported and at least heard about concerns. I 100% felt that way when interacting with Mr. Hyde, and I know that if hired for the job as executive director, the brokers and consumers of Nevada would directly benefit from having him at the helm. Thank you, Mindy Pretner.
Thank you, Mindy, for your public comment. And at this point, I will resume my video. I apologize. I am still connected to you. I will figure this out in a second so you can see my face. But in the meantime, I would like to go ahead with the next item on the agenda and the approval of minutes of the October 14th, 2021 and the recent February 3rd board meeting, just leading us up to today's meeting. And so do I hear a motion from our board for approval of those minutes, both minutes? Thank you.
I move approval of the minutes. This is Elsie Levon Lewis, and I move approval of the minutes of both October 14th, 2021 and February 3rd, 2022.
And this is Jose Melendres, second.
And everybody in favor, please say aye or present or yes.
Aye.
Aye.
Thank you. Is there anyone opposing? No opposing. Were there, I usually would have asked, and I apologize before the vote. I'm assuming, never assume. Since I heard nothing, I usually give you an opportunity to say if you had an edit or you thought there was no omission. So we will go back to that vote, and everyone who approves the minutes, yes, aye.
Aye.
And then anyone opposed? No, okay. So going on to one of the reasons that we're all here today, the interview candidates for this Overstate Health Exchange. We will be doing them in alphabetical order. First, Ryan Hyde, and then Troy Johns. And before we start, there'll be some comments. I believe these will be by Tiffany, just explaining our process. And then we will proceed, and she'll explain the process, which we believe has been well thought out and fair. Tiffany.
Thank you, Madam Chair and members of the board. Yes, for the record, just wanted to go over a couple of things with you. Right now, currently, both candidates are being held in waiting rooms, so they're unable to hear or see the meeting. We will bring in the candidates one at a time for the interview process and then return them to the waiting room once the interview is complete. So we would ask the board to please wait for Katie to be able to confirm that they are back in the waiting room before the board has any discussion. Once we go through both candidates, both interviews, and once a decision is made and the board has voted on who they would like to make an offer to, we'll bring that one candidate back into the meeting, and so the board can offer them that position. If they accept, then the candidate that isn't selected will be called offline by exchange management to let them know. And to assist us today with facilitating these interviews, and if anything comes up, if the board has extra questions on the process, we do have with us today Michelle Garten, Deputy Administrator with the Division of Human Resources Management, and also our DAG, Michelle Briggs. So if there's any extra questions I'm not able to answer, they can assist us as well. And as you said, Madam Chair, they will be interviewed alphabetically. So Ryan High will be first, and then Troy Johns will be the second one to be interviewed. Okay, any questions from the board?
Thank you, Tiffany. So I just want to clarify the one item, which is sometimes when candidates are interviewed, there could be discussion after each candidate. And in this particular case, just to clarify so that we're all on the same page, and if there's any concern from the board members now, they could bring it up. We'll do the one interview. They will go in. If you feel there's something urgently you need to say, absolutely, once we've been told that everything is clear, you could go ahead and proceed. But since there were just two candidates, we decided to go right into the second candidate and ask questions without really having a discussion about the first candidate until after the two candidates are done. And if there's any concerns about that, you could bring that up now. Otherwise, we'll just do the two candidates back to back, then open up for either a discussion or really just go straight to vote unless there is a need for a discussion. So were there any questions on that? So I will go ahead and proceed then.
Madam Chair, Katie will go ahead and move Ryan from the waiting room into the meeting at this time.
All right, Ryan is in the meeting.
Will we be seeing Ryan? Oh, there he is. Ryan.
Hello, good
Welcome. Thank you for submitting your application. It's our pleasure to interview you today. And we'll start our questions with Dr. Friedman.
The first question is, can you please describe your qualifications for this position and why you think you're the best candidate for the executive director?
I'm sorry, could you repeat that one more time? It came through a little bit.
Alexander.
I couldn't hear it too well.
I apologize. I'll try one more time, and if it's still garbled, maybe someone else can read it. Can you please describe your qualifications for this position and why you think you are the best candidate for the executive director?
Sure. Thank you for the question. So my qualifications for this position and why I believe I'm the best candidate is, first of all, I've been here at the Exchange since 2016. I've been the Chief Operations Officer since then, and I'm currently the Interim Executive Director. There have been two other times in the past 2 years where I've worked with the leadership team here when our executive director has taken another position to help the state out. So me being the interim executive director right now, it gives me 3 opportunities to show my experience in helping lead the Exchange here. In addition to my time of being the Chief Operations Officer here, previous positions that I think add to my qualifications are, I used to work for the city of Reno, working on strategic planning and budgeting. I also worked at the Nevada Secretary of State's office as Director of Operations there, and also the Help America Vote Act Administrator. So I have the skill sets that I do bring to this position are budgeting, state budgeting, experience in front of the Nevada legislature, in front of the Interim Finance Committee, in front of the Board of Examiners, also working on fiscal notes during session, strategic planning, like I mentioned, from the city of Reno, and then my 5 years of state-based exchange experience here at Nevada Health.
Go on to the second question. What would you say are the most important professional principles that you use to yourself as an executive director?
I'm I'm sorry, could you repeat that one more time?
Sure. What would you say are the most important professional principles that you use to conduct yourself as an executive director?
Gotcha. Okay, so the most important professional principles are, first of all, I believe that what gets measured gets managed. So setting clear expectations for the team that you're leading. As an executive director, I think it's important to set expectations to let staff know and your teams know what's expected of them and how they'll be measured to perform to those expectations. I also believe that communication is very important. This is something that I learned from our previous executive director, that being firm, fair, and friendly in the way you conduct yourself with not only consumers or sister state agencies, but also important partners that we have, such as our carriers, our navigators, our broker community. That's all very important. So I would say those two, customer service, setting expectations for your staff, also responsiveness too. That's something that's been instilled in the culture here at the exchange, is being extremely responsive to consumers, to carriers, and to our enrollment partners.
Thank you. And the third and final question from me is, could you please describe your leadership style? Please give us specific examples of how you would and how you have used this style to change organizational culture, build successful teams, and resolve serious or long-standing conflicts.
Okay, great. So I'll use my example, the example of my current position as Chief Operations Officer here, and the quality assurance team that I lead, also my partnership with our broker liaison and our navigator manager. So I would say my leadership style that way is to, first of all, is to be a servant leader. I feel it's my duty and responsibility to help raise those that I manage and help make them successful, because that makes the whole team successful, the team that I lead. I try and actively listen to what their concerns are and their issues. I try to provide solutions to what they need either fixed, or if it's an issue we need to solve together. And I do it in a manner where I believe that, especially working here at the exchange, we have rules that we have to live by, the Code of Federal Regulations. So we'll first look at that. We'll see what the issue is. Then we'll see what the rule is that we have to apply to that maybe situation or scenario. We'll perform the analysis together. We'll do it in a collaborative manner. I don't think I'm the smartest person in the room always. I know there are subject matter experts that work here at the exchange that know more than I do. So I know it's important to bring in their perspectives and their opinions as well. And then we'll try and reach a conclusion there. And whether this be maybe a consumer issue or maybe it's a technology improvement that we have to do for brokers or navigators. So that's, I think, the way I would answer that question. And I hope I answered it. If I missed a part, please let me know.
I could just follow up with the final part of the question, using your leadership style to resolve serious or long-standing conflicts. Do you have any examples in that area?
I'm sorry.
Dr. Freeman, sorry, this is Tiffany Davis. Sorry, I don't mean to jump in, but it's really hard to hear you and understand. Could you type in your question maybe in the chat? Thank you so much.
And also, Ryan, sorry, this is Janelle. The 3 questions that have already been asked are in the chat. Tiffany typed those out.
Okay, I see the second part of that question there, Dr. Friedman. How to use this style to change the organizational culture, build successful teams, resolve serious or long-standing conflicts. So what I would do, I would get back to that premise that I said about what gets measured gets managed. I would like to see here at the exchange, and something that I might want to initiate is more performance metrics here, where each of the certain departments or teams here, whether it be reconciliation or quality assurance, or maybe policy and compliance, or maybe our financial teams, would have maybe 3 to 5 key performance indicators or measures that we could consistently track, whether that be on a weekly, a monthly, and annual basis, to try and fine tune any areas where we might see that needs improvement. That would be one way I would do a little bit of organizational culture change. To build successful teams, I would revisit our vision and mission here at the Exchange, which I think is what has been in place since its inception in 2013. That might need a refresh, and I think looking at that holistically with our entire staff, again, to get feedback, collaborative feedback from everyone, to see now that we're a state-based exchange, where we were first a state-based exchange, then we were in the SBMFP, and now back to an SBE, to see if that vision, mission, those priorities might need a refresh. And then to resolve serious or longstanding conflicts, I think it's first of all, we'd have to identify what those are, recognize those, and then to move forward for any longstanding, which I personally, I don't think we have a lot of those here at the Exchange, but there's always need for improvement, whether it be improvements for technology, improvements for customer service, so on and so forth. I think the best way to solve that, resolve longstanding conflicts, is to come, first of all, recognize what they are, and then try and come to a consensus with whatever party that is that we need to discuss those with. Again, the culture here at the Exchange, and I hope this has been seen, is it's very customer service friendly. Like I said, no matter if it was for consumers, for carriers, for sister agencies, or enrollment partners that way, we try to actively listen, we try to have empathy, and we try to come to the best resolution possible with that consumer focus in mind.
Thank you so much. Sarah, Florence Jameson here. Sarah, did you have anything else you wanted clarification on your questions?
No, thank you.
In that case, we will move on to Jonathan Johnson. Thank you, Jonathan.
Yeah, you bet. Ryan, great to have you on. You alluded to this in a previous question, but this role involves pressure from a number of different stakeholders, including insurance agents and brokers, insurance carriers, state legislators, consumers, small businesses, etc. How would you balance these competing forces?
Understanding that the success of the Exchange is increasing the insured rate for Nevadans, and providing a stable, user-friendly platform for them, taking into consideration all these sometimes competing interests that you just mentioned. So I think the way we've done that so far that has been successful is to take it piece by piece. And if I can give some examples about how I think we've done that, is first of all, in the consumer aspect, we here at the Exchange perform not only quarterly updates to our technology or enrollment and eligibility platform with the interest of looking forward 3 months at a time to see what's the best thing we can do for a consumer. As we do that, we also take in the thoughts of the broker and enrollment facilitator community as well. So as we're helping to streamline the processes for the consumer, we're also thinking, if we're streamlining it for the consumer, how can we also streamline it and combine those interests for the broker community, i.e. our new rollout of an agency platform there for both the navigators and brokers there. That coupled with what we have to do for the state legislature, that we sometimes are either included in bills or maybe it's a budget reason that we're asking for improvements, maybe increased staff. Again, improving the Exchange here through a legislative process, whether again it's through an increased budget or working with legislation that we're named in, we will layer that on top of how we can make that work for our broker community and our navigator community, as well as our consumers. So I think it's a layered approach to see how we can mesh all of these different competing interests together.
Thank you. Next question. The exchange is heavily reliant on good working relationships with many other state agencies, both elected and administrative. The exchange is responsible to the state of Nevada for proper fiscal management. Please describe any legislative experience you've had and any experience working with budget planning. Moreover, please explain if you are familiar with the state of Nevada legislative process for submitting budgets. Also, what media experience do you have, specifically responding to media inquiries and/or public relations experience? And how have you handled potential negative or hard questions from the statewide or national media?
Okay, great. I'll take, I think, the legislative part first, and then I'll move to the media part, if that works.
Perfect.
Okay, great. So we're getting ready to get into the budget season right now. Previous experience, when I was with the Secretary of State's office, I was involved in not only federal budgets there, but also statewide budgets as both the HAVA, the Help America Vote Act Administrator, which was a federal grant program, also as the Deputy for Operations, working on the biennial budgets there for the Secretary of State's office. And then moving forward quickly, working at the city arena, working primarily on tying the strategic priorities into the budgeting process there. And then currently at the exchange here, my budget experience has been mostly around working on fiscal notes during the legislative session, also working with the previous executive director on priorities here at the exchange. As we build those budgets, we'll start now in March and work through the summer, and now it's submitted in September, and we'll have the governor's recommended budget, and then after the session, the legislatively approved budget. So it's working on not only the requests that we have here from the exchange, but also working with the LCB, the Legislative Counsel Bureau, the governor's finance office to provide justifications, to provide data for the requests that we do have when it comes to the budget season there. And then presenting also budgets to the legislators during session. So I hope that answers my experience and past experience and inclusion in the budget process. Now regarding media, this is, I have worked with our communications director here at the exchange with mostly written types of communications with media, whether it be national media, local media, whether it be maybe public universities and colleges asking for data requests from us. I believe I have done one maybe print interview or been part of one print interview. And then recently I was also part of an interview. We weren't quoted at that one, but that was for Politico a couple weeks ago regarding the end of the public health emergency and how we were prepared for that. And then, I'm sorry, the last part of your question, I think, was handling difficult or tough.
Yeah, negative or hard questions. Yeah.
Or negative or hard questions. Okay, so from a legislative standpoint, I did go through a program here at the state called the Certified Public Manager course, the CPM course. And one of the first things they taught us was, if we get a tough or negative question that we might not know the answer to, it's okay to say we don't know, that we can do the research and get back to you, to legislators, whether it be during, an interim finance committee meeting or maybe BOE or during the legislative session. Naturally, we try our very best, and I try my very best to be prepared and kind of guess questions and maybe do some mock interviews before we have any of these sessions. It's just so we're the best prepared, but we can never guess every question that we're going to get. And as far as media interviews, I would use that same tact. I haven't had that experience where I've had a tough or negative question that way, but I would, answer directly. And if I didn't know the answer or didn't have the stat, or didn't know maybe the CFR or the rule that we relied on, to get back and provide that accurate answer.
Thank you. over the past few years, the exchange implemented new eligibility and enrollment platform. And thus this position works closely with our contracted technology vendor, Get Insured. How do you see your role in managing the exchange's vendors, and what would your approach be to problem escalation?
That's a good question. I've thought about this in preparing for this interview and potentially having this position, if I'm lucky enough someday to have this. I would treat that relationship as, it's not the same one-to-one comparison, but something similar where I would treat the exchange as almost my third child. I have two children, but almost like my third child, and have that type of deep vested interest in our relationship with our vendor, Get Insured, letting them know that how important this is, not only to the staff here and to myself, but to our over 100,000 consumers here. It would be a very protective relationship of the exchange. And then going back to what our past executive director taught us, firm, fair, and friendly. We have contracts here for a reason with vendors. We can rely on those. It sets expectations of what we expect from them and how we think we should be treated. So it'd be a very protective relationship that way.
Thank you, Ryan.
Thank you, Jonathan, and Florence Jameson here. And we would like to move on. We are halfway through. And to ask Valerie Clark to ask our next few questions.
Thank you, Madam Chair. And it's great to see you, Ryan, today. Here's my first question. What is your specific experience in the field of individual health insurance? And also, could you please describe your working knowledge of insurance rating principles and processes?
Sure. So my specific experience in health insurance has been at the exchange. Before coming to the exchange, I had more of a operations background, of a strategic planning background, but the health insurance I learned here on the fly. I started October 31st of 2016, and it's been somewhat of a roller coaster ride since then. And it's been learning a lot on the fly. And when I say that, it was learning, first of all, how we were operating as a state-based exchange using the federal platform, and getting that knowledge of we were doing everything here as a state-based exchange, but for using healthcare.gov as the technology. And then it was working with our previous executive director and our IT manager to go to present to CMS to make that case for us to become a state-based exchange, why it was beneficial. And then throughout that process, as the chief operations officer, working with our broker liaison and our navigator manager, and just learning about those important partnerships throughout the community, our 600 plus broker community, and our 7 navigators throughout the state, and how important the consumer education is about health insurance, and actually using, once you get it, it's more about using it once you do have it. So I hope that answers the first part of your question. And can you repeat the second part, please?
Yes, the second part was, please also describe your working knowledge of insurance rating principles and processes.
So insurance rating principles and processes. I'm gonna try and answer this one way, and if it's not the right, if you want more, please let me know. But as we start and we're starting the process now with a draft letter to issuers, so that insurance companies will know what to expect come filing season, which runs through the spring and summer. They'll work closely with the DOI, and we are partners with the Division of Insurance here in Nevada. They will actually work with the carriers to set the rates, and they'll usually be finalized early fall, around the September, October timeframe. Traditionally, we've seen maybe not traditionally. Last year was about a little bit over a 4% increase, but I remember previous years where it's been in the teens, rate increases year after year. But with Nevada's landscape, the competitive market, the increased subsidies, especially with the recent ARPA, American Rescue Plan Act enhancements, I think it's also brought a new level of competition to the exchange. I was part of the exchange when we had 2 carriers, and I want to say maybe 12 bear counties at one point. And that was an eye-opening time for the exchange. Now we have 7 QHP carriers, and it's a different landscape, and it's more of a positive landscape, and it's encouraging for, I think, Nevadans that we have this now.
Thanks. Yeah. And I think where I was just going is, do you work with the carriers in asking them to justify how they're justifying the rates that they want to charge, the actuarial formulas that they're looking at, how they derive the rates that they get to? What do they base that on?
We will receive more of the benefits they want to include and make sure that the plans that are being offered and the different meta levels are will meet our CFR and CMS guidelines, but the rate setting is more done by the Division of Insurance and working more closely with the carriers that way than the exchange.
Oh, very good. Okay, great, thanks. Can you please provide a synopsis of what your goals and objectives for the exchange would be, and a general outline of how you would accomplish them if you were the next executive director?
Sure. The overarching goal we've had since I've been here, I think since the inception of the exchange, is to increase consumer enrollment, to lower the uninsured rate here in Nevada, and to make sure that all Nevadans have just tremendous access to good quality subsidized healthcare plans. I would, as I mentioned before, I want to create, first of all, revisit our vision and mission and strategic priorities to make sure we're still aligned and we're tracking where we need to go for that, in our upcoming years. I'd also want to have some more performance measurements to, again, what gets measured gets managed. I strongly believe that. In the next, and if hopefully this answers your question a little bit further, but say if it was a 90 or 180-day plan moving forward, if I was lucky enough to get this position, it would obviously be to start recruiting for another chief operations officer. It would be to meet with each of the division heads here, our recon, our QA, our finance, our policy and compliance heads, to our communications, to see what their needs are. Again, I wouldn't be, I know I'd want to take all of their input because they have specific needs that I, as a chief operations officer, just don't know about in my role. As interim executive director for the past few months, I'm learning more and more about that, but meeting with them and hearing their specific needs and how I, as an executive director, could help them achieve those goals and those needs and solve any issues that they may have, I think would be very important. It would also be to, I think, set clear expectations and give these department heads and staff the power to, greater decision-making power, where it's not maybe a funnel through one or two or the executive director. Give them, setting those clear expectations, setting those priorities, setting that mission and vision, so it's clear to them so they can make their own decisions and maybe have some more latitude in their daily workday.
Fantastic. Thanks, Ryan. And then my last question, can you please tell us what you love about healthcare and the health insurance industry?
Sure. I think it's a very altruistic industry. My entire career, not entire career, as I would say maybe most recent career, has been in public service. I went to a public service oriented law school. I clerked for a state court judge. I worked the Nevada Secretary of State's office in elections, which I think is also a very altruistic type of profession. And I think that's what drew me here to healthcare, was that it's that sense of helping people in a time of need. We hear stories from consumers all the time, and we get to help them with their insurance and with subsidies, so they can afford insurance. We can help them, not only during open enrollment, but during the year if they have a qualifying life event. They know we're here to help them get insurance to help them and their families. So I think it's that sense of public service that I see this position and this agency really being.
Excellent. Thanks a lot, Ryan.
Thank you so much, Valerie. Florence Jameson, and we would like to move on now. Yvonne Lewis will be asking the next set of questions before our wrap up. Levon? I think you're on mute.
I know, just realized that. I'm Lewis here. Ryan, could you tell us a little about yourself and your background that hasn't already been addressed in this interview?
Sure. Let's see, my name is Ryan High. I'm originally from right outside of Annapolis, Maryland. I went to undergrad at Loyola College in Maryland. My first job out of college was working for Maryland Family Magazine, doing graphic design. Then spent some time as a corporate recruiter in the DC and Maryland areas. Came to Nevada for the first time in 2002. Was here for a year and went back to DC for 3 years, and then came back for good in 2006. Again, I've had my most recent part of my career has been in public service, and that's where I intend to stay. That's where I see myself being. Hobbies and interests, anything Tahoe here, hiking, camping, the lake during the summer, or snowboarding during the winter. Let's see, what else can I tell you about myself? As I mentioned, I was in the state's Certified Public Managers Program. Leave that was I think I graduated in 2013. I have started classes or have taken classes after law school at the University of San Diego in business intelligence, a few classes there. And I think, in the interest of time, I'll keep it there.
Thank you. As executive director, how would you work to increase diversity among the staff, state employees? And can you share with us any initiatives you have directed to engage the diverse communities in Nevada?
Okay. To increase diversity amongst the staff. We here at the Exchange, we go through the state's Department of Human Resource Management in our recruiting process. It's a very, it's a standard process that we use here, but possible ways to increase diversity, and I've seen this through other agencies, is if we have the opportunity to maybe post these jobs on varied job boards. Also, we have a very diverse navigator community here. So maybe getting the word out more throughout those different navigating communities. I think those would be two examples I would give to increase diversity here amongst the staff. And the second part, I'm sorry, could you please repeat the second part of your question?
Can you share with us any initiatives that you have directed to engage the diverse communities in Nevada?
Working with our communications manager and our agency of record, the Abbey Agency and Marketing for Change, we've started to do some deeper dives into, when I say deeper dives, deeper data dives into enrollment and application data about who our consumers are, not only our enrolled consumers, but also our applicants and who they are, whether it be age range or race or ethnicity. So we're trying to use that data to make more actionable decisions right now. and whether that be actionable decisions in our metropolitan areas like Clark County or Washoe County, or maybe out in the rurals. And then I also work closely with our tribal liaison, Tiffany Davis, helping her with her updates for the presentations she gives to the tribal community. I think those are a few of the prime examples. It's really learning though, and this is where the Abbey Agency and Marketing for Change has really helped the exchange in the past almost year now of doing those deep dives into exactly who our enrollees are, to see the trends that we're seeing in, like I said, not only age or location, but also ethnicity.
Thank you. Please address your approach to following and responding to federal and state healthcare policies with implications for the exchange. And the second part of that question is, what will you do to ensure that the exchange's messages reach underserved populations, and how the exchange will provide health equity to Nevada?
Okay, so regarding responding to federal and state legislative changes, these are oftentimes opportunities for us to not only improve our technology regarding enrollment and eligibility, but also our policies and our compliance as well. These are, let's say for the most part, we welcome these changes, and we work with our federal and state agencies to enact these and operationalize things that come about, whether it be the maybe the latest version of the Notice of Benefit and Payment Parameters, the MBPP, or whether it comes out of our biennial sessions here in the state of Nevada. Typically, these changes or these changes in law or federal or state policy are to improve access to healthcare, which I think everyone here can agree we could use here in Nevada. And I'm sorry, can you repeat the second part of your question there?
What will you do to ensure that the exchange's messages reach underserved populations, and how the exchange will provide health equity to Nevada?
Sure. So reaching our diverse community through messaging, that's one thing that we're working with the Abbey Agency and Marketing for Change on now, is seeing how our messaging is reaching different segments or populations. And we're learning that our messaging to Hispanics and Latinos is actually really effective here at the exchange. We also have strong partnerships in the Asian community too. Knowing that if we have messaging maybe in Mandarin, Tagalog, that might increase enrollment in those certain communities. And then, I'm sorry, there was a third part to your question I want to get to. I don't want to miss it.
How the exchange will provide health equity to Nevada.
So health equity, I think that's a topic that has garnered a lot of attention lately. And I think it's building trust in communities that might not have trust in government services, whether it be at the federal or state level. It's building messaging around, what these benefits are, the potential low cost of these benefits, and especially healthcare services, our industry that we're in, but also consumer education. I think that's a huge part of it. If we can get messaging out to all diverse groups regarding if you can enroll on these plans, if you can enroll and have it subsidized, and not only enroll and have it subsidized, but if you can use it, we can help educate you, being that major force here or major voice here in Nevada regarding health insurance and health insurance usage in diverse languages. I think that will increase decrease the uninsured rate and increase healthcare usage here in Nevada.
Thank you.
Thank you, Yvonne. At this point, I have a few wrap-up questions. Ryan, if you were selected as the executive director, when are you able to start working in this position in the Carson City office?
Last December. I'm sorry, right away, absolutely right away.
Thank you. Now, at this point, do any of the board members, before we dismiss Ryan, have any questions regarding the information that Ryan has submitted in his resume? Okay. And lastly, Ryan, do you have any questions? Or
I do.
or disclosures, or anything that you would like to discuss with the board that would assist us today in our evaluation process?
I do have a few questions, and I guess one thing I would like to wrap up by saying. So I have 4 questions here, and should I just address them to you, Dr. Jameson?
Yes, although as you know, I love having the whole board to assist me.
Sure. Okay, question number 1. What are the most important skills and qualities required to succeed in this job?
I always give my board that opportunity. So I'm gonna paraphrase that. The most important qualities, did you say quality?
Yes, qualities required to succeed in this job.
So, and you're asking basically the board what we believe are the most important qualities in order for our executive director to
Yes.
succeed in this job. Very good. I would like to open that up for my board to have an opportunity to answer that.
Madam Chair, I'll take a stab at that. Valerie Clark.
Thank you, Valerie.
In my opinion, Ryan, I think this job is a very multifaceted and requires the type of leader that has the ability to be a very big picture, broad leader who can handle the juggling act of dealing with a lot of different and very strong entities, consumers, insurance companies, your staff, the state, the legislative arm of the government. And so I think that is a critical piece of what we as a board would be looking for, is someone who can take on that role with a broad perspective, and someone who has a lot of vision, a visionary, and someone who can collaborate well and maintain a lot of control over all the moving parts.
Okay.
And one thing I'd like to clarify before we go on, Ryan, is I'm sure you can appreciate that opinions on this are as varied as every member of our board. And so I don't want any board member to hesitate what they feel is important, and go ahead and proceed. Any other comments? Levon or Jose, you're still with us?
Well, I would agree. This is Levon Lewis, and I would agree with Valerie in terms of her talking about this being a very broad job, and you have to have the ability to be able to work in lots of arenas and work successfully with the people from lots of arenas. So I think that is essential. And then I think that it is important to manage the outreach from the exchange, so that we continue to show increased enrollment, because that's one measure of the success of our operation. So those 2 things I think are essential.
Jose, thank you,
Yeah.
Levon.
And thank you, Ryan, for your participation today in your responses. The only other thing I was going to add is just understanding obviously the diversity of what we deal with in the state of Nevada, from the different communities and the income and all the different things that we always have to think about. But also, I think one of the things I've appreciated about the staff with the exchange is constantly just kind of the thinking outside the box when things need to get done or when different challenges come from the federal level and all that. So I think that's something that, whoever steps into this role would have to always kind of have that open mind to that process and how things get done and how we engage with the diversity of all the different communities that we are set up to serve. So just wanted to kind of put that out there.
Did go ahead?
Should I move on to the next question?
Well, I will usually reserve a comment, but I will say that I find that today leadership is different than it was, certainly as medicine is, and healthcare is different than it was when I started out in training over 44 years ago. Whole different paradigm. It is not so much the leader, it is teamwork. Emphasis always on teamwork, and the servant leader listening to everyone best and listening to other ideas. I think that that type of leader is the one that will be the most successful, in my opinion, in the world we live in today. And I really have always liked our prior executive directors, fair, firm, and friendly. I think the fairness, being firm and friendly, and backing that up with, you've got to have a leader has got to look at metrics. They've got to define them, and they've got to then evaluate them if we are to move forward and continue to increase access to quality healthcare. There you have it. We could talk hours on that subject. Go ahead.
Thank you. I'll combine the next two questions because they're almost the same, but what is the biggest challenge that someone in this position faces? And what is the biggest challenge that this organization is facing? So it's about challenges regarding someone in this position would face and challenges that the exchange would be facing.
Can anyone like to take that question first?
This is Jonathan. I think one of the constant things that we've seen just over the years is the changing regulations when it comes to healthcare and the dynamic that is. That will continue to be a challenge, and I think something that we collectively have to navigate as those rules and regulations continue to evolve. And the key question is, how do we continue to put the consumer first, right? They're the ones that are impacted the greatest by this. And
to clarify, thank you, Jonathan. The challenges for the exchange and the challenges for the individual, was that correct?
Yes, for the exchange and for the executive director, yes.
Were there any other responses from the board? I would echo what Jonathan said, that I think some of the greatest challenges are when the external forces, whether it's federal or government, a state government, local legislature, bills are presented for you to have to negotiate these for the exchange as a whole, to sometimes work with and not just survive some of the assaults, but try to figure out a way to flourish under some circumstances. I think it has done a phenomenal job, the exchange, with the challenges that were put forth over the last several years with the changes that came to the Affordable Care Act that affected us dramatically. And the exchange rallied tremendously, whether it had to do with our ability to continue to have our marketing not impaired, because without good marketing, you can't succeed. And we took a torpedo there. There were so many ways that the legislation, federally or state, affected, and our exchange rallied. And so you'll continue to have these in our own state legislature, not necessarily always working with us. And so I think that's one of the biggest challenges that the exchange will continue to face as long as there is politics. Unfortunately, we always say there should be no politics in healthcare, but there is. And I am impressed the way we weathered it, and I'm sure the exchange will continue to weather it. And on an individual basis, the greatest challenge for the individual, a new officer, I would say that it is just reaching that goal of our mission and vision, which you may want to, should you get the job, the officer may want to adjust it, because again, we have new things politically, the public option coming along. How do we work with it so that we both succeed? This new individual will have this new challenge, but it goes along with our mission and vision, and together we embrace them and say, how can we provide more access to healthcare, which is our mission? And that's the biggest challenge as the new leader they will have, is how can we increase again the access to healthcare in Nevada so that nobody goes without access to healthcare.
Great. And then my last question is, how is performance evaluated or measured for this position?
Again, I will open that up to the board.
Madam Chair, Valerie Clark, for the record. One thing I would, as a board member, I would measure it by would be the monthly, well, I guess we're doing quarterly board meetings now, but the report that the executive director gives to the board, I think, is a critical piece that allows us to evaluate your performance as well as the performance of the exchange as a whole. So I would say that would be one major thing. And also the overall performance of the exchange during open enrollment would be another thing, I would think.
Did anybody else have any comments? I think that summarizes the biggest metrics. Of course, I think that there's so many things that one does take into account when looking at the CEOs, because as we know, it is going to be in numbers at first glance, but of course, it's going to be how well that person fits in and works with the group. And sometimes that's something at first glance isn't so easy to determine, but nevertheless, in the end, the functioning and the quality of the performance is usually going to be reflected in that. So going back to teamwork, what your team members think of you. So evaluations that come from the team members are very important in seeing how well one is performing, besides the big number of how much our enrollment is.
Great, thank you. And if I can just end real quick, take a few minutes to say that, you know, my dad once told me to, if you want a position, you have to ask for it. Just say it out loud. So I just want the board to know, and everybody listening, that I want this position. I truly do. And I don't want this as just a job, as a stepping stone, but I want it as part of a career. I think the past executive director that I worked for here at the Exchange created just a tremendous culture, a tremendous agency and organization. And I want to take the best parts of that and add to it moving forward. So if I could just leave you with those words that I want this position and I want this job. Thank you.
Thank you very much, Ryan. And at this point, we will thank you so much for your time and your answering our questions. And then we will allow you to go into a separate space somewhere.
Okay, thank you. Thank you, everyone.
Thank you.
Madam Chair, Tiffany Davis, for the record. Yeah, Katie will be moving Ryan High back into the waiting room, and we'll wait for her to let us know when she has successfully done that before we move forward here.
Thank you.
And also, Madam Chair, for the record, while we're waiting for Katie to give us the heads up on that, I would like for the record to kind of reread the first three questions that Dr. Friedman asked, just so those on the phone know clearly what those questions were, since they were a little hard to hear the first time around. So if I may, the first question that was read or asked was, could you please describe your qualifications for this position and why you think you are the best candidate for the executive director? For the record, the second question was, what would you say are the most important professional principles that you would use to conduct yourself as an executive director? And then the third question asked was, could you please describe your leadership style? Please give us specific examples of how you would and how you have used this style to change organizational culture, build successful teams, resolve serious and long-standing conflicts. And just a note that for those who are listening in from our public, that all questions will be asked, the same questions are asked to each candidate and by the same board members. So just for clarification on the consistency of the process and the fairness of the process in that way. And then I believe Dr. Freeman, she wanted to test her mic to see if we can hear her a little bit better.
Okay, I swapped out my mic. Is this better?
Wow.
Much better. That's
I'm
wonderful.
so glad. All right.
Yay.
I apologize for before.
That's okay. Thank you so much, Dr. Freeman, for testing that. And Katie, do you have?
Yep, Ryan is in the waiting room.
Okay.
You know when you want to bring Troy in.
Yes, thank you for bringing Troy in.
Oh, wait, he's not in yet. Are we good to bring him in?
Yes.
Okay.
Oh, unless earlier they had decided that we would just move right through. Yes.
Yes, it's good to bring him in.
Thank you.
Great. Troy is in the meeting.
Welcome. Let's see, I'm trying to see you. I apologize. Oh, welcome, Troy, to our meeting. Thank you so much for your application and your interest in the job of the Chief Executive Officer of the Exchange. And we have several of our board members who have agreed to ask you some questions. And the questions will be the same ones that have been presented to our other candidate. So we will then, without any further ado, as they say, start with our questions. And our first questions will be with Dr. Friedman.
Thank you, Madam Chair. My first question is, could you please describe your qualifications for this position and why you think you're the best candidate for the executive director?
Mr. Johns, can you please unmute yourself? Tiffany Davis for the record.
Thank you very much. Dr. Friedman, I appreciate that question. Well, for over 30 years, I've worked directly with boards and executive management in different healthcare organizations. And during that process, I've had the privilege of working with stakeholders that mirror the same stakeholders that we have in the exchange. And through that process, we've designed, obtained rating for, and application for, deployed healthcare coverage, and then supported that through enrollment processes, customer service, and the functionality that you have at the exchange. And so it's through those experiences that I feel that I have a good grasp of the type of skills that you need and the different members, stakeholder groups that you need to work with. And I can advocate for each of those consumers and each of those interests. I'd also like to say that, you know, I have a passion for making sure that we can cover with quality healthcare coverage every Nevadan that as we possibly can. You know, I just don't think that individuals can achieve all that they are destined to achieve or want to achieve if they have to worry about healthcare coverage, if they can't prevent disease, they can't treat chronic disease, and that hurts everybody. When we have uninsured, our providers can't get adequate compensation for the services that they deliver. That creates a real burden on the healthcare providers. And our employers can't have a productive workforce. So, you know, I think if we don't aggressively pursue our passion to cover everybody that we possibly can, we just can't achieve everything that we want as Nevadans or as a state.
Thank you. And then moving on to our next question, what would you say are the most important professional principles that you would use to conduct yourself as executive director?
Well, thank you for that question. I would say that, you know, I think that it's true in every aspect of our lives, and particularly important for a leadership position. And I would say honesty, integrity, accountability, and reliability. Those would be guiding principles that I ascribe to and that I would bring to this position.
Great. And then my final question is, can you please describe your leadership style? And can you please give us specific examples of how you would and how you have used this style to change organizational culture, build successful teams, and resolve serious or long-standing conflicts?
Well, my leadership style is an alignment of interests. You know, I think if we look at individuals, we see that they have goals and objectives and aspirations as individuals. Then we look at the duties that they have on a job in a particular position. And if those are circles, you know, those circles would overlap. We hope that they're working in a particular position because they want to accomplish a goal or advance somewhere in their career or achieve something on a personal basis. And then we look at the organizational goals, and that's another circle. And if you put those three circles together, they're overlapping, and in a center spot, you have where the organization needs to go, the individual's goals and objectives, and the job duties. And I think if we spend a lot of time to focus on that, so that individuals get to move in the direction that they want to, while accomplishing the duties of the position and advancing the objectives of the organization, then, you know, everybody is very well aligned. I think stylistically, it's important to listen. Everybody needs to be heard. Some people don't like to spend a lot of time talking about those things. Other people do. And so I think it's important to listen and understand each individual and how we, as an exchange for the staff that we have, would work to help them advance in any direction that they want to go. It's not uncommon to have somebody tell you that they want your position, right? And I think what, you know, an element of our success can be judged by, are we effective at producing executive directors for this position? Should an executive director ever leave, or for other agencies? You know, I think that's an ultimate sign of success. If we have people that are able to advance towards where they want to go. And that's very important. And, you know, it's critical to hold on to people. And I think that it's an area that you need a lot of investment in. So specific examples, I can tell you that I have built multiple departments, sales and marketing departments for healthcare coverage. And one of those I did in Colorado, Denver. The chief medical officer, who was a MD, MBA, very brilliant lady, privileged to work for her. She saw me build that for a distributed sales organization called Met Plans. Then she asked me to interview for the director of the HMO position, a new position there, because they wanted to build a sales function and department there. So I joined that team. Sometime later, this was Dr. Ashbach, she became a consultant for an organization that wanted to start an HMO. And she suggested to them that they bring me over to develop their sales and marketing function as their vice president. And so I think that's one of the signs of a successful development of a department and a team, where the organizational leader makes other moves and then invites you to join them in another organization. So I hope I answered your questions there.
I apologize. That was a very long question with many parts. So just to follow up on the last part of it and give you an opportunity to respond, if you could give a specific example of how you've used your leadership style to resolve serious or long-standing conflicts as well.
I worked with an organization, and two of the board members had a serious issue develop between them. It resulted in a change in the structure of funds that were coming into the organization from investment into a loan. This was a major problem for the organization. It changes your balance sheet substantially. It changes what kind of programs you can fund for your growth and to achieve all of the goals that you set out to. This developed over a period of time, and what we ended up doing is I met with the key stakeholders, each of the board members independently, and then also the key employees, and we put together a program that would demonstrate how we were all in this together. And the end result was that we were able to see a way for reconciliation of the issue that separated people, because it wasn't about the organization. So we focused on the organization's objectives, brought everybody together, and the result was the ability to wipe off over $2 billion of long-term debt, which was substantial for our organization. And so we started with a very positive balance sheet following that interaction.
Great, thank you.
Well, Madam Chair, I can't hear you if you're, I think the microphone, thank you.
Yes, thank you. Thank you so much. And we'll go on with Jonathan Johnson. Thank you, Jonathan.
Troy, great to meet you, albeit over Zoom. You alluded to some of this in some of your prior responses, but this position involves pressure from a variety of stakeholders, which include, insurance agents, brokers, insurance carriers, state legislators, consumers, small businesses, et cetera. How would you balance these competing interests, competing forces?
Thank you, Mr. Johnson. I think that we have pressures similar to that, albeit this is high level. In everything that we do, every day we're dealing with stakeholder interests and trying to find a way forward and to satisfy them. I believe that we can make a case where increasing the number of Nevadans covered by quality health insurance solves a lot of the state's problems and challenges, and that we are better off doing so. I think that based on what I know of Nevada Health Link and the exchange is it's an exemplary organization. I mean, hats off to you as the board and the staff, because it's incredible work that you've done. And so that makes our starting place much easier than it would be if there were a lot of problems. But I think we can get down to the essentials with every single stakeholder, and we can say, you know, we are reliable, we are cost effective, we are covering people and helping them be more productive. This helps employers, this helps the state's economy. For the broker and consulting community, you know, they need to have health coverage that can be offered to their constituents that allows them to continue to grow their business. And, you know, with the reliability, the statistics, the communication that staff has been able to continue, you know, I think we can solve that stakeholders' needs. You know, for the healthcare providers, you know, we have to show increasingly that we're going to solve this problem, and it's not going to stay, the numbers aren't going to stay in terms of the number of insureds at the same level, because they will eventually lose faith with us. You know, Nevadans send their representatives, both at the executive and in the legislative branches, to make sure that we get our job done. So, you know, I think if we develop relationships by meeting with all of those stakeholders as frequently as we can and get to know them, and they can see and sense our commitment to resolving these issues in a way that's accountable and reliable and effective, that our problems in that regard will be minimal. And, you know, I think it would be naive not to say we will expect surprises in positions, because that happens in a political environment. And so by being excellent in everything that we do and being open about it and communicate about it, if issues come up, we address them in a forthright manner. I think that we can handle that pressure and demonstrate how we're aligned with the needs of Nevadans.
Perfect, thank you. So this next question is multifaceted. It's rather lengthy, so I'll start with that. We'll break it down into a couple of key areas, and I'm happy to repeat any part of it as needed. But the exchange is heavily dependent on good working relationships with many other state agencies, both elected and administrative. The exchange is responsible to the state of Nevada for proper fiscal management. Please describe any legislative experience you've had, and any experience working with budget planning. Moreover, please explain if you're familiar with the state of Nevada legislative process for submitting budgets.
So I've had the, I don't know if we can call it the pleasure, but I've worked with budgets for my whole career on small budgets and large budgets. We had a block of over $200 million of business when I was with an organization in Arizona. Included in that, the employer groups that we covered there was the state of Arizona. And so I worked with the state of Arizona on plan design and deployment of different types of coverage, HMO, point of service, integrated plans. We also had the privilege of covering legislators as insureds, and working with their benefits managers. So we've had a lot of work, or I've had a lot of work where we're dealing with the needs of legislators as consumers of health coverage for organizations that I'm a part of. Also in the benefit design and learning about their interests and being able to reflect what they need in terms of cost controls, medical management, ease of access, distribution of providers to meet the needs of their workforce. And so I've seen that firsthand, and then reflected that in plan design and network design through the organizations that I've worked with. That budget was somewhat similar to the exchange, with the exception I didn't have to cover some of the operational expenses that have to be reflected in the budgets that we submit for the exchange to the state. I'm aware of the process, that builds prior to each session, and then the accountability that the exchange has to handle the budget reporting and answer questions and get that approved on a periodic basis. In terms of the legislative process here, I'm familiar with how the Assembly works and the Senate works, and how the executive works. And I think we've recently seen the executive at work with the cost benchmarking. That's going to be very important for us and all of the divisions that serve the executive. Mr. Johnson, did I give you enough information about that?
Yeah, I think, the key part to that question is, working with budgets and working through the state's budget, process. That's a critical part to, part of the role of the executive director with the exchange. And so, there's a specific process to that. That's critical. So yeah, thank you for kind of sharing your experience and past work with the state of Arizona. That's helpful.
Mr. Johnson, I would also say that I do enjoy, from the perspective, if I'm privileged enough to serve as your executive director, that the budgets have been done so well and so effectively in the past, because it's easier to work from that basis than to create them from scratch, which I've done a few times. So that is a favorable position for whomever you choose as your executive director.
Sure, thank you for that. So next part of this is related to your media experience. What is your experience there, specifically responding to media inquiries or public relations experience? How have you handled potential negative or difficult questions from statewide or national media?
I've had limited exposure to national media, but my thoughts about media prep is I've had some. I have enough to know that I'd like to spend time with, I think, is it Janelle, who's in communications, and also the experts at Abby, because I don't think you can ever be prepared enough. We live in an environment where somebody who has an obligation as a reporter to capture something live might only have seconds to do it. And so we have to consistently have top of mind, what are the key points that need to be made? How can we say that clearly? So from a media perspective, I think that's essential. I think it's a very important responsibility for your executive director to be attuned to what is likely to be asked and be ready to represent the exchange in a clear, concise way, and know that media relations are vital and important. It not only gets us, extends our brand in a positive way, but it's also, our duty to keep people informed about what we're doing and how we're doing it. So I have some media experience. I have learned that you do have these thoughts, the critical thoughts, top of mind, because if there's 5 seconds to present it, you present your key points in the last 5 of a 10-second presentation, it doesn't matter. So did I get to the core of the matter there?
Perfect. Yes, thank you. So last question from me. Over the past few years, the exchange implemented a new eligibility and enrollment platform, and the position of the executive director works closely with the contracted technology vendor, which is Insurer. How do you see your role in managing the exchange's vendors? And what would your approach be to problem escalation?
Well, I think anything that's critical to the outcomes, how the covered lives that enter through the exchange or are somehow touched by the exchange, any of those relationships are vital. And to the degree that staff says any of those relationships would benefit by having executive director presence, then I want to be there for them in the way that they say that they need the kind of support that the executive director could provide. I also believe that it would be beneficial to be very proactive, and for every constituency group and every vendor get insured included, it would be important to make introductions and get to know them just as soon as possible, and to know how the exchange is working for them as well. I think we can all agree in most cases what our objectives are and how to get there. And with respect to escalation, I'd like to see, because I think it works best if whomever is primarily responsible for that relationship from a staff perspective, if they can handle the issues that arise. And sometimes they can't. Sometimes vendors don't perform up to the standards. And then I'd like to see them escalate in accordance with whatever management system that we have in place. I don't perceive that needs any change. At some point, it may get to the executive director level where an intervention is needed. But what I find is we can do our most good if we have a good process in place. And if we follow that process, and then when there's a breakdown, we get to go back and look and figure out, well, why did it break down? And then we know how to address it should the same symptoms arise at a future time. And so, I feel like it's dangerous to be the type of person who just jumps in too quickly. Now, the nature of some issues, the people involved in some issues, sometimes that requires a different course, and you have to get involved quickly. But I would perceive that we would have a trusting relationship between everybody in the exchange and the board, and that we could all collaborate on strategies to fix whatever issue arises, and then do that in an accountable, transparent way.
Perfect. Thank you.
I think you're muted.
Thank you, Jonathan. And going on, Valerie Clark will ask the next few questions. Thank you, Valerie.
Thank you, Madam Chair, and good afternoon, Troy. It's nice to see you. My first question, what is your specific experience in the field of individual health insurance? And please also describe your working knowledge of insurance rating principles and processes.
So my experience, I have been designing employee benefit plans as a sales rep, and then sales manager, and then vice president of HMOs and marketing leads for MetLife HMO, later acquired by United, for about 40 years or more. And so I have an in-depth knowledge of the rating principles and the underwriting principles that are in place, primarily for group insurance. I haven't been an individual underwriter, but I think that the group underwriting experience and rating experience I have is highly applicable to the accountable care coverage and the distribution and underwriting and actuarial principles that we use in it. I've been involved in multiple rate filings, working with actuaries and underwriters and submitting rates to departments of insurance in multiple states, and then working to address any concerns or issues they've had. I've also had the privilege of working with medical directors and chief executives, medical management teams, underwriters and actuaries to go out to work with hospitals and physicians as we try to talk about different kind of capitated and value-based care arrangements, and then representing the way that sales and marketing through benefit design and rating can help manage the risk and make a more predictable experience for them, so that they're not taking on more risk than they understand and how they're safeguarded against those risks. So I believe, Vice Chair Clark, that I have a very good grasp of underwriting principles and actuarial principles and rating principles. Not exactly individual person underwriting for individual coverages, but for groups of one and enormous number of small groups. One of my experiences that was interesting is when in the Denver market, everybody at that time was very standoffish of working with multiple employer groups, where you would offer a composite rate for related to age, and I was able to help that organization pivot to be willing to offer a Chamber of Commerce plan, and then structure it in a way that we could handle the age swings that can occur if you have, say, an employer group that has 2 employees, and one is 30 and one is 40, and then one of those employees leaves and they replace it with someone who's 62, that can have a dramatic effect on the risk profile. So we worked with a way to adjust for those types of things and still offer the Chamber a very appealing and compelling plan. So I've tried to share a little bit there about the applicability of my understanding of the rating principles.
Excellent.
Right.
Yes, thank you. That was very helpful. Can you please provide a synopsis of what your goals and objectives for the exchange would be, and a general outline of how you would accomplish them if you were the executive director?
I guess our benchmark is we want to move the needle on how many people remain uninsured. And so we will need to find a way to address whatever is causing those people that are eligible for our exchange's coverage, to cross the barrier of enrolling. I would typically price is somewhere involved in that decision-making process. I mean, the coverages that are available are extraordinary. So we would have to figure out, because I've seen some really incredible outreach that the exchange is doing. So we're getting the word out primarily. We want to spend some time to figure out exactly why don't we have more people enrolling on a regular basis. I think we have to really focus on and prepare ourselves for what's coming, though, also, as some of the ARPA benefits and subsidies disappear. We have to be watching very closely for how that's going to impact the people that we already have covered, because that's going to put some pressure on holding on to the enrollees we have. So I would perceive that we would spend a lot of time trying to figure that out and be as proactive as we can. We also know that this is a little bit unrelated, but it drives the bandwidth that an individual has financially. As rents are going through the roof, and as the protections for people's housing costs are disappearing, that's going to be a huge economic pressure on on our enrollees and those who might otherwise be able to choose to be enrollee. There just won't be enough dollars in their accounts. And we have to protect the individual economies. And if we don't protect the individual economies, then we can't do as much as we can for the state's economies. So those are things that be looking at. Certainly the public option is something that may play a positive role in this. So it'll be interesting to see how that proceeds. I'm hoping that the federal government might have some additional options for us with respect to waivers that could help us address these forthcoming issues, because they have to be seen by everybody. So I would get staff's recommendations on these matters and make sure those are presented to the board, and get your guidance and direction on how to proceed. I perceive that my skill set is a great complement to the skill set that exists at the exchange presently. And so maybe perhaps together with this wide range of expertise, we might be able to come up with some new ideas and recommendations and ways to implement them that would be attractive to the executive or the legislative branch.
Great, thank you very much. My last question, can you please tell us what you love about healthcare and the health insurance industry?
Well, it's such a cornerstone, you know. It's so nice to have health coverage and to not have to say, you know, I have to restrict my activities because I can't afford to get sick, right? Or I can't afford to have an accident. And to not have that worry, well, that's a blessing we want for everybody. So it is really fun to help somebody say, hey, here's a coverage program that's good for me. It's got great providers that are available to me if I get sick. I understand what my cost ramifications are when that happens. And there's a cap on how much I'm going to have to pay. Yeah, I can go on with my life because I can do this. You know, this is great. And you know, you're an employee benefits. There's nothing like it. And when you can do it and do an enrollment meeting and you've got all kinds of people there, you know, and they're like, wow, you know, this is really fantastic. You know, and when you think about some of the outstanding work that's being done by some of the new provider organizations, and they're thinking about value-based care, their focus on prevention, their focus on chronic disease management, and integrating different providers in different ways, and sharing medical information to reduce costs. I mean, this is an exciting time to be able to bring healthcare coverage to people, and those things just, you know, that makes me happy, you know, to think about being a part of doing that and doing it on the scale that we can through the exchange. That's a really compelling reason that I was happy to see this job posting.
Great, thank you very much.
Thank you. And we will be winding up with our questions with Levon Lewis.
Thank you, Timothy. Troy, would you tell us a little about yourself and your background that hasn't already been addressed in this interview?
Well, I hope you have a sense, Ms. Lewis, for my passion for this position and healthcare. I have had the privilege for about 20 years to serve as a trustee for an organization named Friends in the Desert Foundation. And Friends in the Desert was initiated in part by Mayor Gibson, Henderson mayor many years ago. At that time, Henderson was the second fastest growing city in the nation. And yet we had people that were dumpster diving and not able to put, you know, a meal on the table. And so Friends in the Desert started as a group of people just wanting to make a difference as volunteers. And my wife is a Battle-born native. I met her in Dallas, and we moved to Henderson in 2020. So I'm almost getting my native rights, I think. But I was sitting in the Department of Motor Vehicles next to a gentleman, and we were talking about things, and somehow the issue of food insecurity and homelessness came up. And I told this gentleman it was on my mind because of some things that I had seen and how I tried to help and felt ineffective. He goes, "Well, funny you should mention that. Why don't you come to our board meeting?" And so I joined that organization, Ms. Lewis. Long story short, you know, through about 3,000 volunteers a year, we've been able to serve 25,000 hot sit-down meals to the homeless and insecure, you know, every year for the past 20 years. And we were able to keep that program, that meal service program, going through COVID-19. We had to shift how we did it to go meals, but something I'm very proud of, something I'm excited about. And it really shows what, you know, when we have gaps in the market and things aren't being addressed in a constructive way, you know what, the philanthropy and good-natured aspect of people can make a difference. We can do something about it. And you know, one of the changes as serving as their president right now, working with the board, we just decided that we're going to recruit a social worker, you know, because part of our relationship, Ms. Lewis, is we have to, you know, make sure that we're taking care of our community too. And business leaders don't always find it consistent with their business ideal to have organizations that are serving in this way. And so we feel like unless we're also addressing the root causes of homelessness, we're not going to be able to take care of our neighbors as much as we want to. So that's an area I'm really excited that organization has pivoted. We've raised funds, and we're going to be hiring a social worker to help us address some of the root causes that have kept some of the people that we provide meals to in a homeless state. So I'm excited. That excites me, and it feels great to do something as a volunteer and make a difference in that way.
Thank you. Tell me, as executive director, how would you work to increase diversity among the staff, the state employees? And can you share with us any initiatives you have directed to engage the diverse communities in Nevada?
In Nevada, with all of the organizations I work with, we are happy to work with, employ, volunteer alongside anyone who has a passion and an interest in doing it. Most of my my work for diversity has been a focus on making sure that our board representation at Friends in the Desert has as much female participation as we possibly can. We also, you know, want to serve anybody who comes to us in need for whatever reason. And so our outreach is really in our duties. I think we have a lot of programs available to us for those privileged to work for the state to make sure that we can provide mentorship, we can make positions attractive, and we can help bring along anybody who has an interest in working with us and serving alongside in a way that increases the diversity, and through that, you know, we get to look through another set of glasses and see things that we haven't seen and approach problems in a new and constructive way. and maybe help to address the underrepresentation of some of the exchanges covered lives, you know, in terms of the Hispanic community and other underserved communities.
Thank you.
Thank you, Ms. Lewis.
Please address your approach to following and responding to federal and state healthcare policies with implications for the exchange. And the second part of that question is, what will you do to ensure that the exchange's messages reach underserved populations, and how the exchange will provide health equity to Nevada?
In terms of following legislation at the federal and state level, you know, I think we can be attuned to that 100% of the time and check all the potential sources for that. Subscribe to the notices that would bring those to our attention, and then work with our policy experts across the state who are also paying attention to those things to make sure that they're immediately on our radar, and we can start our process of determining what to expect and how to react to it. You know, I think we should look at where we have coverage gaps and where we are struggling to meet the equity needs of those that we're covering. And I think we take that data and we benchmark ourselves and we say, where are we today? And we say, why are we there? And what do we have to do to move the needle here? What are we going to do to make a difference and increase our coverage and our exposure in each of these communities? We have Abby. The Abby people are really very effective at understanding marketing messages and reach. I think that if we bundle that and we go to the communities that are underserved and spend time with them, be able to exchange, explain exactly how we can participate in their lives and how we go about it, how easy it is to do. And we use language materials that support easy communication based on whatever languages are spoken in those communities. I think we can make a difference. I don't think there's any substitute for spending time with people and working on what the barriers they're facing and showing them how through the exchange we can overcome some of those. And I think we do have to be mindful, Ms. Lewis, all the time of what we're expecting financially from people. When the subsidy is not there, we still have to offer them something that they can afford to buy. And I think we want to spend a lot of time to couple our message that's specific to whatever the underserved community is with a compelling price and product combination so that they can take an action.
Thank you.
Thank you. Thank you very much, Troy. Thank you, Levon. We just have, I have just a few questions to round out the interview. And first one, if you are selected as the executive director, when would you be able to start working in this position in Carson City?
Thank you, Madam Chair. The March 21st would be ideal. I think with the intensity and nature of things that are before us, if I can get read in to anything prior to that time, I'm certainly open to that. I don't know what the requirements are with HR management in terms of when somebody can be briefed, but so March 21st, and if something is needed before then, I'm open to it. but it may take some time to secure a place to stay in Reno. I hear Reno and Carson City a pretty hot market right now.
Thank you. And I would like to ask our board members if they have any questions regarding the resume that you submitted. To the board members, the resume that we've all reviewed. Did you have any questions now that you've had an opportunity to have questions asked and answered? Were there any questions, concerns, or that you thought you have wanted to address on the resume? Hearing none, then.
Madam Chair, I have a question real quick. Valerie Clark.
Yes.
Just one question. I was reading over your resume, which is very extensive. I noticed that you've been president of your company since 2001. What has prompted you to want to make a change from being president of your company for the last 21 years to doing something like this, which looks quite a bit different than what you, in terms of just, you know, being in the private sector versus the public sector? What just prompted this?
Fair question. May I tell you a story?
Sure.
I was, you know, that the pandemic has changed, you know, a lot of things, and for my company, one of the things that it's changed is where we have had software solutions that people install on their own networks, and they don't want to do that anymore because their employees are working remotely. And so, you know, we are pivoting. We have a software as a service solution. We also have a couple other software as a service solutions, and one that was primarily an installed solution that people would run on their own computers or networks. And I was working on the cloud deployment version for early release for that one day, and I got an email. And it was time for a break, so I looked at that email, and it from somebody who knows me really well and knows of my professional experience and knows about my interests and passions, says, "Wow, this job was made for you." And I said, "What?" And so I didn't open it. You know, I just looked at the headline and I said, "Well, what would a job look like, you know, that I would be willing to make a change for?" And so I thought about some things, and, you know, I have loved employee benefits, and I love healthcare, and I love making a difference. And so I said, well, if it's in healthcare, if it leverages this increased focus we have on behavioral health and addressing the needs that people have there that have really been exacerbated by the COVID pandemic, maybe not exacerbated, but we know about them to a degree that we never have before, and there are novel solutions to help with that. And I could conceivably make a difference, and I could help individuals improve their own economy. You know, when you have a healthcare condition and you don't have coverage, your economy's wrecked. You know, and by doing that, I could help, you know, employers and families. And I could help contribute to Nevada being the best that it could be. You know, I was like, yeah, that if I could make a difference in some of these ways with respect to healthcare, yeah, I would do it. So then at the end of that day, I took a look at the job description and I started thinking about it. And you know, I thought that I could make a contribution to what the exchange does. I would be a good complement to the staff that's there, a little bit different perspective and different experience base. And, you know, got to be honest with you, I watched, you know, you all as a board work and deal with problems, you know, and overcome those. And I'm like, this is a culture that finds a way to do things in a really exemplary way. And I'm like, that's the kind of team I want to be on. That's the kind of team I want to be a part of. And so, you know, those things together, I know I've made a long story of that, but you know, that made me say, yeah, if I meet their criteria, if they find that I'm a good fit for their organization, that's a culture that I'd like to be a part of. I don't think it's a fixed project. I think it's a go forward and do new things that are going to make a difference, you know, opportunity. And you know, those are great career opportunities. And so I felt really happy to see. I mean, your prior executive director, boy, she was phenomenal in this role, and I'm sure she is. You understand she moved to get insured, and so you know, I'm sorry that the exchange lost her, but you know, it's great to see people growing and doing new things, and I'm glad to have this opportunity to meet with you, Ms. Clark and Ms. Lewis and Ms. Jameson, Madam Chair, and all of you. I see some staff online here, and hope that I'm privileged to be offered the position.
Thank you. Lastly, do you have any questions or disclosures or anything that you would like to discuss with us, the board, so that it could assist us in our evaluation process and decision making?
Well, I'm wondering, from a priority perspective, if you know, you're what are you watching? What are you excited about an executive director playing a role in that's coming before you? You know, is it the Patient Protection Commission, 1332 waivers, the public option? I mean, what's on your radar? What are you kind of ready to have another person carrying some of this load and making a difference in for the exchange?
I'm going to, as I always do, first open it up to my team and invite our board members to see who'd like this opportunity to answer first, second, or third.
I mean, I'll just say something real quick. Valerie Clark for the record. I think, you know, the board has transitioned over the course of time. You know, when we first started, there was just building the infrastructure, the technology. We've gone through a lot to obtain the technology that we have now, and the independence that we have as a state board is critical. I think from my perspective, it would be a very important thing to now start becoming more visionary on the role that the exchange plays within the state, and being a bit more proactive on finding the people that need our services that are out there. And we have been proactive, but I think we will have more time now that we've got our infrastructure built to really make a name for ourselves in the state of Nevada in a way that the transition would, or that an evolution would direct us to go. So that's where I would see, you know, what I would be looking for as a board member in terms of an executive director, someone with that vision of how we could do that.
Thank you.
Thank you, Valerie. Should I put anyone on the spot? Anyone else? Jonathan, look at that grin.
I also,
Anything?
that was very consistent with Ms. Lewis asking about reaching new communities too. It's very consistent with that that vision.
I would just, nobody else on that question, then I would just add, I couldn't agree with Valerie more. I think that we have reached a remarkable place the exchange finally breaking through that glass ceiling of over 100,000 lives in our last enrollment period with an amazing, I don't want to refer to our staff as a well-oiled machine, because it's really, as we pointed out during your questions, it's their amazing human component, their incredible, compassionate, caring, but also combined with their phenomenal expertise, ability to look at data, try to set new goals, bringing on the looking at it as an opportunity, but not a challenge, to bring on our amazing new platform with Get Insured, which really has been so user-friendly and given our clients so much we were dreaming of for years. So as Valerie said, we have accomplished quite a bit, and we could rest on our laurels, or we could say, oh my gosh, we are far from having every Nevadan insured. And there are certain things on the table now, like the public option, and some people wonder, and there's a little negativity around it. But we need to embrace these things, see how we can work with it, especially our new medical director and the exchange, and really reach new levels of decreasing the uninsured in this state. And where could that take us? Some of those communities of diversity, they have many undocumented, even people that are here legally, but not eligible, haven't paid in 5 years. You know, in many places across the United States, opportunities are opening up to include them. In my field, OBGYN, they're being included instead of waiting 5 years or 2 years in our state legislature. There's just so many opportunities to continue, as you say, bringing healthcare to everyone, because no one should have to feel that they don't have access to healthcare, because we do believe that everybody should have access to healthcare. Everybody deserves to have a healthy, long, productive, and happy life, and be able to get out there, take care of themselves. Everyone in the low income area, undocumented, we have a long way to go before we solve the uninsured problem. We now have to think out of the box, and we want our new director to think out of the box. And maybe this all sounds very aggressive, but as long as there's someone uninsured who might die because they just don't have access to health care, or in Nevada, 1 in 4 women without maternal care, we have a long way to go. And we have this amazing exchange to use as a vehicle to take us to that goal of, as Gates likes to say, 0 people uninsured. They say, how many, what's the number you want to do? What's the number? Give us the number of reduced premature births in the world. Give us a number. He says, let's think about that other magic number. 0 uninsured in Nevada.
Fantastic. Well, thank you. That was, that's fantastic. It would be a great organization to be a part of.
So you still have that opportunity. If there are any other questions or disclosures or something you would like to discuss with us?
No, I am inspired and looking forward to your decision.
Thank you so much for your application, your time, and this wonderful interview today. And we are going to now have our staff move you into your waiting room. And I just can't tell you how much I appreciate your interest in our organization and in our people in Nevada who need to have access to healthcare, as you clearly pointed out in your answers to our questions today. Thank you.
Well, thank you. It's a real privilege. And thank you to all of you who have asked me questions. I really appreciate your consideration.
Troy has been put back into the waiting room.
Madam Chair, it looks like Katie just confirmed that he has been moved into the waiting room. So now we can move on to the agenda item 5, if you would like, with the selection.
Oh, boy, this is certainly harder than I thought it was going to be. But we have this amazing board. and collective minds. And so what I'd like to suggest is going straight. I would like to entertain a motion. If someone would like to offer a name of one of the two candidates, for starters, a motion to offer X person the job of the executive director of the exchange and of the Silver State Health Insurance Exchange, subject to all HR requirements. And if you're comfortable, board, on going with this right now, one of you can make that. If for any reason you feel you'd like to have a discussion first about any particular issues that you may want to talk about, that certainly can be. Otherwise, I would be happy to entertain a motion if you feel ready to vote. Am I on mute? I know it is so difficult, but as the chair, I will defer to one of you members. I'm putting the pressure on one of you to take either name for a motion and start there.
This is Jonathan Johnson. I think I just want to share maybe some comments before we get to that point. Maybe
absolutely.
Discussion amongst the board. That's great. I'm impressed with both Troy and Ryan. They each have unique attributes and characteristics that I think would be of tremendous benefit to the exchange. Different backgrounds, different experiences. Ryan, I see, more from the, logistics and navigating the process of, working with the state and kind of his background and experience there. Troy's background in healthcare and just his passion, was really exciting. So I'm torn. I feel like it was didn't really like having to go through this process and losing our prior executive director, but really pleased with the candidates that we have.
I would like to say we do have an option where if we wanted, and at this point I will also ask after I finish this comment for Michelle to make any comments, which is another option is because I do believe many of us, and that was our long pause, that long silence, is that very torn, two excellent candidates. So if you guys feel, and girls, if you board members feel it would be a benefit, we can always ask a few more questions to help us decide. For this, I would like to call on, I think probably Michelle G. Garton. Comments.
Yes, nice to see all of you. That they are some amazing candidates. I have to agree with you there. I think that's an absolutely appropriate idea. It would be sort of like considered a second round, I would say. Sometimes that is helpful to narrow down from 5 to 2 or something like that. But I think that's a good opportunity if you wanted to ask some more, obviously different questions, but questions that would maybe help you to get over that finish line there with one of them.
And thank you very much, Michelle. And I also, any comments from Michelle Briggs on this?
Hi, Madam Chair. So
Michelle, what I would like you to address is, should we decide to do this, the question of of how would we implement it? Would we do that today? Would we have to table this and set another meeting and leave our poor candidates hanging, create our new questions in a thoughtful manner, return at a later time? I must say, as a board member, although I deny being OCD, I shudder to think at spontaneous questions not well thought out and just throwing them at them from anyone. I wouldn't want to make this important decision based on such a unthought out process. So I would love guidance here, and then we'll go back to the board and ask if the majority would like to take a vote now, more discussion, or questions and etc. based on your answer. No pressure.
Okay, thank you, Madam Chair. Of course, this is all within your discretion, so you can have another meeting. You can bring them back now. You could, and it's possible at your next meeting, you could have more of the board there, and maybe that would make it a little easier to make a decision. So if you wanted to wait and not bring them back now and bring them back in a week or two, that's up to you. But you're right, it would be better to have maybe more thought out questions, unless you guys have specific questions that you think would help you make a decision today. And if you do, then I think it would probably be better to finish it today. But if you don't, I think that's a good idea to wait until you can think about it a little bit and then put together some questions that would narrow it down.
Michelle, thank you very much. So what I would like to propose is for us, I'm going to ask for a motion, and I putting in a comment here, which is there's no fire, there's no urgency. There is a great desire to make this decision, but it is a huge decision. And we've been blessed with great leadership. We've been blessed with current staffing agreeing to be an interim executive director. I'm not sure if we need to reassure ourselves or get confirmation that this person would be okay with continuing to be our interim, should it take another 2 or 4 weeks to come to this decision, or whether it's just assumed that they're going to be okay if this does take a little bit longer. But if it is the case that we have in place our safety net with an interim director willing to continue, then the vote not being pressed, that is an option for the board to consider now.
Well, this is Yvonne Lewis, and I just wanted to make a comment. I am not sure that asking more questions would really help us in terms of making a decision. You know, I think that we have asked and received answers to a sufficient number of questions to get a good feel for both of these candidates. So, you know, what is it that we would hope to ascertain by asking additional questions that would help us in terms of making a decision? Is it just that we're just not willing to make a decision? You know, is that where we are? Both of
Thank you. Yes, thank you very much, Levon. So I think the question at hand is for someone to make a motion to see if we're ready to vote. And if so, we'll proceed with a vote.
Well, this is Levon Lewis again. I move that we vote today on the candidates that we have interviewed and see if we can reach a decision on one of these candidates.
Oh, thank you very much, Levon. Do I hear a second?
Sarah Friedman, I second.
All right, thank you, Dr. Friedman. And now, having had a second, is there any discussion before we take the vote? Okay, can I have Tiffany do roll call and take the vote? The vote being on whether we go ahead and vote on our new executive director now.
Thank you, Madam Chair. I'm happy to take roll call for our voting members. Valerie Clark,
Yes.
Levon Lewis,
Yes.
Sarah Friedman,
Yes.
Jonathan Johnson,
Yes.
Jose Melendres. I believe he had to leave us for another meeting unless he's returned. I don't think so. And then Dr. Jameson.
Yes.
That concludes our voting members, Madam Chair.
Okay, but I'm glad we went through that. I think we're all realizing that although it's a struggle, we can go ahead and make that. Levon, thank you. Okay, so again, I will now entertain a motion from somebody on our board, a motion to offer X name of candidate for the job of executive director of the Silver State Insurance Exchange, subject to all of the HR requirements. Do we have a motion?
This is Sarah Friedman. I'd like to make a motion to offer Ryan Hyde the position of executive director.
Okay, so I do have a motion from Sarah to offer Ryan Hyde as the job of executive director of the Silver State Exchange, subject to all HR requirements. Do I hear a second?
Jonathan Johnson, second.
Okay, well, any discussions before we go on to the vote? Okay.
My only statement is this is one of the hardest decisions I've ever. We have two great candidates, so just for the record.
Totally.
I agree with Ms. Clark that this is a very hard decision.
Thank you so much for the comments. So we'll do a roll call vote. Tiffany?
Thank you, Madam Chair. Ms. Valerie Clark?
Yes.
Ms. Elsie Levon Lewis?
Yes.
Sarah Friedman?
Yes.
Jonathan Johnson?
Yes.
Again, I'll ask if Jose Melendres has been able to join us. Not hearing him. Dr. Jameson?
Yes.
And that concludes our voting members. Dr. Jameson.
Thank you, everybody. I know that was a very difficult decision, and I am extremely excited for us to, I'm just a real moment of celebration here for us to offer Ryan the position as the executive director of the Silver State Exchange. I think it will make his day. Could we have one of our staff inform Troy how very much we appreciated his participation in this process and what a difficult decision it was made, and we thank him from all of us so much.
Yes, Madam Chair, Janelle Davis is happy to make that phone call, or not happy, but she will be making that phone call.
Thank you, Janelle. Thank you. And then we would love for who was it that's going to bring our candidate back into the room?
Katie
I
will
can
bring
go
him
ahead
back.
and bring him back in. Are we ready?
We are so ready.
All right, Ryan is back in the meeting.
I was just waiting to actually, let me see him on the screen. We changed the format. Ryan.
Yes.
Thank you so much for joining us. As representative of the board, I would like you to know that the board has unanimously voted you as our new Chief Executive Officer, Director, and that your greatest wish, hope, prayer, and dream to be our Executive Director has come to fruition. And we've, as you, extremely blessed to have you. And we want to thank you so much for, are you still with us?
I am. I'm
Oh,
here.
good.
Yes.
Good, good, good. Something happened on the
Absolutely.
screen. I just want to thank you so much for all of your incredible years of service
Thank you.
to the exchange, your amazing passion and desire to continue at this level and to now take us to new levels with all the amazing opportunities until we have 0 uninsured people in the state of Nevada. I would love for you to go ahead and speak to this wonderful new opportunity if you'd like to say anything.
I'm just so appreciative. And first of all, yes, I accept, and I'm just so appreciative. And just know that I will cherish this opportunity, and I won't let you down.
And we know that, which is why we all voted for you. And we
Great,
just
thank you.
appreciate everything you've done and have high hopes, and I think not unreasonably high expectations for the amazing job that you will do in the future. So thank you so much, and God bless you. Thank you.
Great, thank you.
Now, I think we should all take, what do you think, everyone? Maybe just a 5 or 10 minute break, and then let Ryan collect himself. And although you do seem very collected, calm, and then we will prepare to go on with the rest of the meeting. Tiffany?
Sorry, Madam Chair. Yes, that sounds good. 5 to 10 minute meeting or break. What would you prefer, 5 or 10 minutes?
I think just a 5-minute break. And I'll go ahead. I'll just put myself on mute, and then I don't think anybody needs to sign out. Stretch your legs, touch your toes, reach high for the ceiling. And we just give our greatest thanks to all of the staff and to Ryan, and are really excited moving forward. Have a good little 5-minute break.
Thank you, Madam Chair.
Welcome back, everybody. Does it look like we have everyone tuned in?
Madam Chair, I think this is Tiffany Davis for the record. I think we're getting close.
All right, I'll just wait for you.
Madam Chair, Tiffany Davis again for the record. We do have a quorum who are here and attending.
Excellent. So we will go ahead and resume. I would like to start now with the Executive Director's report.
Great. Thank you, Madam Chair. In the interest of brevity, I'll kind of summarize a lot of these topics in here so we can keep this meeting flowing here. The Silver State Health Insurance Exchange, for the record, it's Ryan Hyde, Executive Director. The Silver State Health Insurance Exchange spent the second half of 2021 preparing for and executing on the exchange's third open enrollment period as a state-based exchange. Additionally, the exchange continued providing a special enrollment period through August 15th, 2021, where the exchange implemented increased subsidies, expanded the federal poverty level for subsidies, and provided $0 plans for Nevadans who claimed unemployment insurance as a result of benefits provided in the American Rescue Plan Act of 2021, or ARPA. The exchange both concluded this SEP in August and prepared for the third open enrollment period starting November 1st, 2021, while transitioning back to work through a hybrid staff schedule in both our Carson City and Henderson offices. The exchange's third open enrollment period proved highly successful and broke previous enrollment records with a plan year 2022 total enrollment of 101,409 consumers.
Woo-hoo!
Very, very exciting. This enrollment success is a direct result of strong efforts in marketing and outreach, tremendous statewide broker and navigator partnerships, a reliable and stable enrollment and eligibility system, and consistent expert advice provided by our call center. Regarding vendor management, the Get Insured technology platform concluded in the ARPA SEP on August 15th, as previously mentioned. And at the conclusion of the ARPA SEP, the exchange enrolled 17,094 consumers. This was a special enrollment period last summer. It is important to note that during this record-breaking year of our open enrollment for plan year 2022, the call center, one of our highlights here, continued to maintain expected and contracted service levels for Nevada consumers, brokers, and navigators. As the exchange makes an effort every year to expand call center hours and availability into weekends during our open enrollment period, the call center was open for both consumers and enrollment professionals, both Saturdays and Sundays through open enrollment. Additionally, the call center extended hours until 11:59 p.m. PST on 1/14, 1/15, and 1/20 to accommodate end of open enrollment enrollments. With this being the exchange's first open enrollment with a new marketing and outreach vendor in 5 years, the Abbey Agency, the exchange recognizes the contributions that the Abbey Agency's marketing and outreach strategies and campaigns made to Nevada's enrollment success. The exchange saw success in advertising storylines such as Traditions, Being There, Healing Knee, Super Saver, and Weightlifted. Janelle Davis, the exchange's communications manager, will highlight more on these marketing and outreach efforts in her following report. Regarding preparing for the end of the public health emergency, or PHE, for several months now, the exchange has been working in coordination with the Department of Welfare and Supportive Services and the Division of Healthcare Financing and Policy to adequately plan how to best service Nevadans needing health insurance coverage in the event they transition off of Medicaid when redeterminations begin in volume at the end of the PHE. As the end of the PHE is yet to be determined at the writing of this report, we just had recently learned that it has been extended, although the end date has not been said. The exchange is actively planning with the two aforementioned state agencies and its vendor Get Insured in order to assure that Nevadans in need will properly and efficiently be account transferred when appropriate to the exchange for a seamless opportunity for coverage. The exchange is planning to enhance its contracted call center through funding from the Center for Medicare and Medicaid Services through a state exchange modernization grant. Upon final direction from CMS that the PHE will definitively end, the exchange will stand up through Get Insured, a special team of CSRs charged with making outreach to redetermined Medicaid clients that are deemed ineligible to continue on Medicaid, but may have opportunities on the exchange. Regarding federal and state legislation updates. From June 2021 to December 2021, the exchange tracked a number of federal and state legislative priorities that continue to have impacts on the exchange. This included ARPA, the Build Back Better Act, CMS's Plan Year 2023 Notice of Benefit and Payment Parameters, Nevada Senate Bill 420 from the 2021 session, and Nevada Assembly Bill 432 from the 2021 session. On December 28th, 2021, CMS's annual draft Notice of Benefit and Payment Parameters was released. This release welcomes and solicits public and state exchange comment. The exchange's comment can be found on nevadahealthlink.com on our public notices page. And I'll just reference that again in terms of brevity. All of our comments can be seen there in our official letter to CMS. Continuing on the state level, two important pieces of legislation that the exchange continues to follow closely and that may have significant impacts in the future is AB 432, which will designate the exchange as an automatic voter registration agency, and SB 420, commonly referred to as the public option bill. The exchange has been participating in public listening sessions where stakeholders can provide input and ask questions regarding priorities, affordability, rate setting, provider contracting, value-based payment / cost containment, benefits, strengthening the marketplace, and licensure / oversight. Work on both of these bills will continue throughout calendar year 2022. And last, but definitely not least, new exchange staff had started in the state fiscal year. The exchange is pleased to announce that 3 of the 4 new positions approved by the 2021 legislature within the exchange's governor's recommended budget have been filled. These positions absorb functions and responsibilities previously provided by CMS. The exchange is excited to welcome Navita Casaretti, a business process analyst at BPA1 in our reconciliation unit. This position will support increased workloads due to additional insurance carriers anticipated to join the marketplace or that have joined the marketplace for our 2022 season, for a total of 7 QHP carriers, and including 11 with our QDP, our qualified dental plans. The exchange is excited to welcome Griselda Chapa, hired to be the exchange's newest health program specialist in the communications unit in the exchange's Henderson office. This position will have in-house responsibility for outreach planning, coordination, and statewide community relations and partnership building. Additionally, this position will assist in streamlining the exchange's efforts to conduct outreach to targeted, at-risk, uninsured, and underinsured populations to increase enrollment in our QHPs. The third position that the exchange is hired for is a classified program officer in the Quality Assurance Consumer Assistance Unit. The exchange welcomed Kayla Yost to this position to administer carrier support in partnership with an existing program officer due to increased carrier participation. Kayla provides timely investigation and resolution of carrier complaints related to eligibility, enrollment, and coverage. This critical position ensures positive outcomes for both carriers and consumers. The remaining position to be filled is a data analyst position. While the exchange has been actively recruiting this position since October, it has advanced as far as conducting interviews and landed on a candidate that unfortunately accepted another position. The exchange is hopeful to have this position filled before the next board meeting. And that's my report. Thank you.
I'd like to thank our Chief Executive Director for that excellent report and ask our board if they have any questions or comments. Wow. Is that a first? I got to make it a home run. You know, there's a lot I could say. I always do, but I don't think I need to at this point. I think that your report is excellent. And the rest of everything that you may not have said is quite included here for everyone to read. Well done. And we will move on if there's no questions, then to the next item on our agenda. So it is, I don't want to say that wasn't exciting, Ryan, but you know, we do all get excited about marketing.
We did.
It's fun. Let us go ahead and have the marketing and outreach update.
Thank you, Madam Chair. Janelle Davis, Communications Director for Nevada Health Link for the record. And I'm just going to give a brief overview. I'm not going to read the whole report. We've all been in this meeting for a very long time. And I'm going to pass the mic over to the Abby Agency and just after my quick summary here. I just want to say that this open enrollment was the most successful in the history of the exchange, and we are all very, very proud of that. We had over 100,000 enrollees. We had, of those, about 21,000 were new enrollees to the exchange, and about 28,000 were active re-enrollees. Nevada Health Link also ranks the highest among all state-based exchanges in terms of new enrollees and 17th in the country overall. And so I just wanted to review some contributing factors that the Abby Agency and I have kind of identified to our success. Nevada had a large market, obviously, of the uninsured population. Because we had the opportunity to do in-person events again with our navigators, we were able to attend 43 community events. We reached 38,000 people and engaged almost 21,000 Nevadans from the period of October 1st to January 15th. That October timeframe is our window shopping when we gear up for open enrollment and the traditional marketing campaign. Our PR efforts garnered strong awareness. We had 201 pieces of coverage and 2 million coverage views. And the Abby Agency will go into detail of like what that really means and what impressions are. But we had a very strong impressions from digital paid media tactics with a lot of engaged users. So the campaign performed very well, to say the least. We had millions of page views on the website and an average session duration of over 11 minutes, which is very, very high. Our website is our call to action. And so people spending a lot of time getting educated and reading what we have to offer there is a really good sign that we're doing the right thing. We had the Abby Agency and the communications team at the exchange worked on a new website navigation and design of key pages and email design to benefit the consumer user experience. The target audiences, I think we all know, but I'll just mention them again quickly for this campaign, were those who were currently enrolled, they needed to re-enroll, and those who had not yet enrolled. So this is uninsured Nevadans, rural Nevadans, individuals and families statewide, the 50+ age group, the sweet spot of 26 to 45 age range, the young invincibles or millennials, members of the Nevada tribes, the Hispanic Latino population, Asian Americans and Asian Pacific Islanders, African Americans, and other multicultural populations. Something that we also pride ourselves in, we reached the target audience of Nevadans that meet federal requirements of low income. And so nearly half of all of the enrollees have a net premium that's $100 or less. 88% of those are receiving subsidy assistance. And then this open enrollment period, we saw a greater impact on the Hispanic and Latino communities in our state. And that was something that we haven't reported as much on. So 9.1% of new enrollees identified as Hispanic Latino. Prior to campaign development, our research indicated that dedicated assets needed to be developed that was more authentic to the Hispanic Latino communities in our state. Spanish campaigns outperformed English on almost every paid media platform. We had public service announcements, filmings, community partnerships, and numerous radio remotes. We did a lot of research and surveying with our subcontractor Marketing for Change, and the website performance data shows that there was an increased awareness in the rural regions of our state. We don't want to forget about the rural part of the state. So a notable increase of over 100% in website sessions from most rural regions in Nevada. And then this traffic is attributed to specific paid media tactics that targeted the rural community. So radio, print, billboards, and outdoor digital. And then also we were able to reach a significant portion of the younger audience in our state. So 74% about of new enrollees were one-person households. Washoe and Clark County had the highest percentage of single households, and about 19% of new enrollees were around the age of 19 to 30 years old, and 25% were 31 to 45 years old. We reached the African American and the API populations of Nevada in the following ways: through Google campaigns and connected TV, so streaming services, digital and mobile billboards targeting zip codes that have high percentages of these populations, and then campaign creative featuring that demographic. So I will now turn the mic over to the Abbey Agency team to give a review in more detail our exchange media and marketing campaign and our performance metrics.
Yeah, thank you, Janelle.
Oh, just before you start, I want to pause and ask if the board up to now has any questions. Janelle, do they have any questions of what we just, or comments? Congratulations. Any comments or questions?
I would just like to say congratulations, this is Savon Lewis, on your outreach and your accomplishments for this enrollment period.
Thank you, Ms. Lewis.
I guess I would just like to ask, you have some great data here, breakdown, and I just might have missed it. But right now, what is the official number of the Nevadan uninsured? And how many out of the total number of uninsured are actually eligible for our program? And if you don't have that, you can send it to us later. I'm just wondering how we, when we started this years ago, how we would always say, 1 in 10 are uninsured, and now it's down to 1 in 5 or 1 in 4, and they'd give us a number not too long ago, 200,000. I'm just wondering what's going on with that number, but you can actually get back to me with that and any different type of a number metric that you'd like to later. And then what I was wondering about was when you said congratulations that we were first with regards to the number of new enrollees in the country. Congratulations, that's awesome. And then 17th overall with the number of people that enrolled, or how is that for our percent population? Was that a percent population 17th? Because after all, of course, 17, if you compare to some huge state, but we might have had we have small numbers, so we might have been a better percentage than they were.
I believe, Janelle Davis for the record, I believe that 17th in the country overall was among all 50 states plus Washington, D.C.
But was it an absolute number of people signed up, or was it relative, was it the percent of eligible? You see, because we might have rocked it as the number relative of that were eligible. We might have been number 1 versus if it's just an absolute number and we're comparing ourselves to a big state. I didn't know which that was.
And correct me if I'm wrong, I'll turn it over to Ryan or Connie or Ashley, but I believe that was in terms of new enrollees.
Oh, I thought in terms of new enrollees, we were just number 1.
That was first number 1. I will get back to you and report. We were #1 for new enrollees. I think we were #1 for state-based exchanges as well, and then 17th overall federally. I believe that was the gross enrollment numbers. I don't know if that is adjusted or provided for population.
Very good.
However, we can confirm with you.
Oh, thank you very much. And then, of course, because those are interesting metrics to understand. Almost no matter how you cut it, you guys have done an outstanding job. I'm just wondering if it's even better relative to the other states than we think. Did you do, I think you have on your, you do a survey. Of course, what finally brought on the new enrollees? Why did they join? I think you in the past used to say what brought you to the exchange, not just how did you hear about us, but what actually finally brought you to us. Were a lot of them, do you have any information if they were brought on to us because of the COVID and concern to get health coverage, or is it totally due to our incredible marketing to some of the subgroups that we've been trying to reach and you've reached them more successfully? Do you know why we had such great numbers, and or what is the most successful, the top 3 reasons why people joined us or found us? Just curious, and if you don't have that, that's okay.
I can answer and then also pass it over to Ryan, our new executive director, if he wants. But we've talked about this a lot, and I think it's a lot of different reasons of why Nevada saw such success. You know, we re-enrolled all of our re-enrollees, so that always brings the number back up. I think that COVID also had a lot to do with that. And then the American Rescue Plan Act, you know, that increased and expanded subsidy assistance for a lot of Nevadans. And they saw that opportunity of affordable qualified health plans and enrolled, and also due to our marketing and messaging as well. So lots of pieces.
Yes, very good. Do we have any kind of survey that goes on as to, in the end, you know, how after you've maybe done something out in the world, you always get an email and it asks you, how easy was it to sign up for this? Who referred you to us, or what was the major reason you did it? Did we ever do that?
I will pass that question over to the Abby agency because we did a lot of surveys.
Okay, now if there's no other questions, those were just big overviews and it is a long meeting, so I will let it go there and ask for you to go ahead and continue your presentation.
Perfect. So let me dive into this a little bit, and then we can speak to some surveying that we did and are continuing to work through. I will just share screen here. Some of this Janelle covered, so I will speak a little bit more in detail. For the record, my name is Ashley Bear, and I'm with the Abby agency. So for open enrollment period, Janelle mentioned that we, with our Price Compete campaign, had a variety of creative outlets. We wanted to make sure that this was authentic and engaging to each target audience that we were speaking to. We wanted to ensure that the talent was diverse in ethnicity, but also in age as well, and making sure that it was relative to all kinds of family types, new, older, and all kinds and all sorts. The messaging instills a sense of confidence. We wanted customers to see that this is an actionable journey that they can take, and they know how to do this, and we're here for them as we take them through that journey. Messaging focused on both comprehensive health insurance and also private health insurance, driving that message home, and making sure that along with utilizing the carrier logos, that consumers understood that the exchange was a vehicle for purchasing private health insurance at the lowest possible price out there. In some of the early surveys that we did in June of 2021, that helped inform and develop this campaign, both the creative and also the messaging, knowing that consumers didn't necessarily, there was a miscommunication and understanding that this was private health insurance that was being offered through the state-based exchange, and that the creative really needed to speak to a variety of people, all kinds of Nevadans. We additionally, as Janelle mentioned, the entire campaign was developed both in English and in Spanish. And you'll see that across the board. We believe that this was one of the most effective measures that we took in helping to engage the Hispanic and Latino audience. And then lastly, the tagline that we utilized, where health insurance competes for you, creating that service element for Nevada HealthLink, and also letting consumers know that Nevada HealthLink is here to provide healthcare for you, Nevada. Again, Janelle mentioned some of these notes here, so we can just kind of go a little bit more in depth. Confirming for you that the ranking is percentage increase in new enrollees. So Nevada HealthLink had a 24% increase in new enrollees. The average state had a 17% increase, and the average state marketplace was 8% increase in new enrollees. We did this kind of deeper dive after open enrollment, because that was kind of our first question too. Was it just an anomaly because of COVID? There was a large uninsured population. How are we comparing across the United States? And certainly, as Janelle mentioned, it's a variety of factors, but we do think that the outreach and marketing efforts were in depth and tailored well to what Nevada needed at the time. And we can certainly see the numbers in reach. So as Janelle mentioned, Nevada opened up, was open and closed a little bit during this time, but we were able to attend over 40 community events, reaching quite a few people and engaging with over 20,000 Nevadans at these events directly. We think that was a really strong community presence for us in a time when there was a little bit of uncertainty. PR efforts garnered strong awareness. We had a really great press conference kicking off open enrollment, over 200 pieces of coverage, which translates into 2 million coverage views. This we found was a really strong tactic for us in a time when there wasn't a lot of in-person interviewing, which we had done in the past, but we were able to really put out quite a few pieces of coverage that helped kind of like make up that gap that we were seeing in the market there. From the digital paid media tactics, we had over 13 million impressions. This is paid social media, Facebook. We utilized TikTok to reach the younger audience, Pinterest. Additionally, we had Spotify radio ads, and then some of your more traditional paid media tactics, Google display and search. Search being the top tactic, and we see that quite often. And I'll note a little bit later, but Google display really helped in reaching the lower income audiences that we were trying to reach. So it was really nice to be able to utilize all of these tactics kind of across the board. Additionally, linked with LinkedIn, we saw that we were really reaching not just small business owners, but Hispanic small business owners, which is an audience that we previously weren't able to kind of tap into where they were. So really starting to see all the like micro audiences kind of come out of this. The website, as Janelle mentioned, over 15 million page views during the open enrollment period. But the stunning metric here is that time on site is over 11 minutes. Typical time on a website is maybe 2 to 5 minutes. So 11 minutes is really astounding. And then a lot of work with the exchange on really thinking in depth about the user experience end to end, ensuring that from the start, the website navigation is clear, communicative, and thinking about the customer journey in mind. We redesigned key website pages and all of the emails that were being sent to new enrollees, current enrollees and re-enrollees, and then the Medicaid and eligible audiences. Then diving into, again, the key audiences, these are kind of some of the big points that we're really proud of with this campaign. We reached kind of 4 main audiences, the low income audience, the Hispanic and Latino communities, the rural regions of Nevada, and then a huge increase in enrollment with younger Nevadans. We know that we reach those that meet the federal requirements. As Janelle mentioned, nearly half of all enrollees have a net premium that's $100 or less, and 88% are receiving subsidies. Again, we found that the strongest tactic that we utilized were Google paid media tactics. We were showing that that audience was very responsive. The lower income audience was very responsive through that paid media tactic that we utilized. The impact in the Hispanic and Latino communities, as I mentioned, our Spanish paid media outperformed English on every single platform. So we were very happy to see that. To us, that tells us that we developed creative that resonated with that audience. We had some that were funny, some that were serious. And so we really could have a campaign in market that over the course of time continued to engage that audience. Additionally, our community relations and Hispanic public relations team engaged in a variety of radio remotes, public service announcements, community partnerships. We did a couple of Facebook Lives. So really getting out kind of boots on the ground and getting into that community and engaging them. I think the most surprising audience that we saw kind of come through with this were the rural regions of Nevada. We had some big ideas of getting out into the rural areas, and unfortunately, the Delta variant and Omicron kind of put a stop to that for us. So we really focused in on some very specific paid media tactics in those regions, utilizing radio, some outdoor, some print ads, billboard, and then we had an outdoor digital tactic that targeted users in that area. And we saw, I think in over 30 regions, 30 rural regions of Nevada, over 100% increase in website visitation, and at times over 200%. So and that's looking at year over year. So these are audiences that were just not necessarily touched in the same way last year, that we were able to engage and saw a really strong response from. And then I'd say the largest that we saw in the metropolitan area, so mostly Washoe and Clark County, the single households featuring younger Nevadans. So over 74% of new enrollees were one-person households. And we're seeing a majority of them were in the 31 to 45-year-old range, but then also a pretty large chunk, over 18%, that are 19 to 30 years old, which is interesting because you don't technically have to come off of, your parents' insurance until you're 26. So really engaging them to get out there and kind of charge them with taking on their own future. So we were really excited to see these key successes from the campaign that we put together. Additionally, to your point, we've done several surveys at the onset of the campaign to ensure that development was on par with key stakeholders. We surveyed brokers and navigators to ensure that we were gaining their feedback at the onset of the campaign. In addition to polling the call center to make sure that all content that we developed over the course of the time throughout the open enrollment campaign was meeting the general needs of the consumer that they typically see, making sure that we're answering their questions in advance if we can. And then post open enrollment, we are engaging in surveys with the enrollees, and then some additional larger surveys as well. So that we can see the impact of Nevada Health Link in the marketplace over time, now that we've had a couple of campaigns in market. So,
thank you. Back at you. Thank you. We do still have a lot of business. So are there any comments or questions? Otherwise, we'll go ahead and move to the next item on our agenda, not to minimize that outstanding report. Thank you. So moving on, item number 8, which is the adoption of the 2023 carrier premium fees to be charged to insurers. And I believe everybody has seen the attached notice of hearing of fees to be charged to insurers. So at this time, I'd like to ask a board member if they would like to make a motion for the adoption of the 2023 carrier premium fees, which will be charged to insurers.
This is Jose, motion to approve.
Second.
Hillary Clark, second.
Thank you, Jose Valerie. And if everybody, everybody who agrees for this motion to pass, say yes here, approved.
Aye.
Yes.
Aye.
Aye.
Good. Any opposed? Okay, it is unanimously passed. And moving right along to item number 19. I'm sorry, 9. It feels like 19, right? 9. Approval of the semi-annual fiscal and operations report pursuant the NRS 6951.3701(1)B to the governor and the legislation. This is for a motion for action approval. Do I hear a motion from one of our board members, please?
So moved.
Who was that, Valerie?
This is Yvonne Lewis, I'm sorry, and I don't know that I can make that motion in that fashion. I would like to move approval of the semi-annual fiscal and operational report pursuant to NRS 6951.3701(b) to the governor and legislature.
I'd say you did it beautifully, Yvonne. Do we have a second? Any comments or discussion? Hearing none. Everybody in favor, say aye or
Aye.
yay.
Aye.
Any opposed? Hearing no opposition, there is approval of the semi-annual fiscal and operation report. And moving on to item, can we really be there already? Number 10, discussion and possible action regarding dates and times. Oh my goodness, we have flown through here. Of times and agenda items for future meetings.
Madam Chair, Tiffany Davis, for the record, we do have scheduled thus far the next board meeting to be on June 23rd at 12:30, unless the board determines that there needs to be another meeting before that time.
Okay, any feedback on that, or is that right now anyway? Satisfactory with everyone? Well, okay, very good. If there are no other discussion on dates, times, or agenda items, then we can move right to our public comment. And Tiffany, would you check in the various locations if there is any public comment now?
Yes, Madam Chair, Tiffany Davis for the record, I'd be happy to do that. Katie, are you able to see anybody who's raising their hand for public comment online?
No, I'm not seeing any.
And just for verification, Caitlin, there in our conference room, is there anyone for public comment?
No, Tiffany, no one's in here.
Thank you, Caitlin.
And I then, hearing no public comment, would like to.
Madam Chair, I do believe, I'm so sorry. I think that Troy Johns would like to make a public comment.
Oh, excellent. Troy?
Madam Chair, thank you. I wanted to thank you all for allowing me to participate in this process. Congratulate Mr. High, and it's such an exciting organization to watch. You're going to do great things, and I appreciate this little opportunity to be a part of it. So thank you very much, and thanks to all those great questions that you asked.
Troy, I would like to thank you very much for your participation And it was an extremely difficult decision for the board. And we so much appreciate all of your answers and just you. And God bless you in your future endeavors. And everybody, hearing no other comments, then I will say, have a wonderful day. The meeting is adjourned.
Thank you. Take care.
Thank you. Bye-bye.